My name is Mick, and I'm National Advisor for Counselling for the Children and Young People's IAPT programme. And one of the main parts of my job has been to look at ways of extending some of the CYP IAPT principles out into the counselling community and people who are delivering evidence-based counselling interventions. And I think one of the real challenges around this area has been looking at the question of the interface between counselling services and statutory CAMHS services. We were hearing Norman Lamb talk earlier about the importance of integration and integrated services, and some of the research that we've been doing has been hearing from counsellors and also people in statutory CAMHS services, talking about some of the difficulties, some of the challenges of really bringing together these two big providers of mental health care for children and young people, and ensuring that they're working in ways where there's integrated, shared pathways, shared system of referral, and where they're really talking to each other about how they're working with children and young people. One of the big developments we've had in the last years is the work that's been done in Liverpool around an integrated CAMHS pathway, where they're really leading the way in terms of looking at systems that can be developed right from the commissioning level that allow for a much more integrated way of working than I think we're all aiming for. So what we're going to do on this panel, we're going to have three of our colleagues from Liverpool talking about the work that we're doing. That will be for about 40-45 minutes, and then there will be time for questions and discussions. I know there's other people who have been involved in developing integrative working, so hopefully there'll be other contributions as well from the floor, and hopefully we can have a discussion and think about how we can really take this forward in terms of learning from Liverpool and learning from other projects. So, we're going to start with Lisa, who's going to be talking from a commissioning project about some of the work that's happening in Liverpool and how they've been really working to develop this integrated care.
Okay. Hiya, I'm, that light's bright. I'm Lisa Nolan, and I am now what you call a Programme Delivery Manager for Liverpool Clinical Commissioning Group, and I lead on children and maternity. Prior to that, I've been a Joint CAMHS Commissioner for probably now 10 years, and CAMHS is still in my portfolio. I'm going to talk, as Mick said, around the commissioning perspective and the strategic side, and I'll give a bit about the history of how we've got to where we are today. So Liverpool, anyway, Liverpool is a city, obviously, of high deprivation. It's got about 100,000 children and young people. It is one of the most deprived in the UK. It's got a high proportion of vulnerable groups. So obviously, mental health problems are expected to be high. The main presenter problems that are coming through are CAMHS providers around emotional disorders, behavioural and self-harm, and many of them also have adverse childhood experiences. And our main referrers are education, child health services and GPs, and these postcodes will mean nothing to you unless you come from Liverpool, but that's where our main referrers come from. And that's our expected prevalence basically at each tier. So our Liverpool CAMHS partnership, since I've been in post, which is now over 10 years, has always been quite strong. It's always been needs-led, it's always been family-centred. It's now made up of a range of providers, which is multi-agency. It provides a continuum of care with some targeted support. It's engaging, involving and inclusive. It's jointly commissioned, which I'll go on to talk about later, and that's obviously developed over the last 10 years. And it's very strong, I think, as well. So how did we get there? Well, I like Doctor Who, by the way, so you're going to see Doctor Who as we go through. So I'm going to take you through a journey, really, now, from when I started, pre-2003. So I'm sure we all recognise the tiered diagram of CAMHS. This is what we had pre-2003, and it was very much medical, hospital-based CAMHS provision. And if anyone was around in 2003, that's when all the sort of development started nationally around the CAMHS grants, NSF, Every Child Matters. But pre-2003, this is all we had at the time. We had one provider, David Tennant, he's my favourite, one commissioner, and we didn't report anything. We didn't know what was going on, basically. So then when the NSF came out, Every Child Matters, some new money came along. We started to develop some of our services. And we still used our tiered approach. So we developed some mental health awareness training, which we called Mad, Bad and Misunderstood, which is actually been recognised nationally now and is used quite a lot across the UK. And then we started to develop some other services, mainly around the early intervention stage of the pathway. So we did start commissioning some services from YPAS. We did start commissioning some early years services. And so we ended up with more providers, more doctors. The services were jointly commissioned. So we had Liverpool PCT, as it was at the time, and Liverpool City Council, because if you remember the CAMHS grant that came through the local authority. And we obviously started to put a better performance monitoring framework in place. And we were sort of developing choice of services for children and young people. They were less stigmatising. They were more accessible, more community-based. So then the journey continued and we developed even further. So between 2007 and 2010, we developed more around the early intervention stage. Participation became really high on our agenda. And we developed a Children and Young People's Advisory Board called Fun Youth Involvement, FYI, who fed into the commissioning level. If you remember CAMHS, that was out during that phase as well, targeted mental health in schools. And basically, as you can see, we had more and more services at each tier. It was very policy driven now as well, I have to say, because there were obviously targets to reach attached to the NSF. So we did have a lot of targeted services at that point. So we had a looked after children's service, we had an early years service, and we had a young carers service, we had a school-based service. You know, it was very policy driven. So therefore we then had more providers, even more doctors. Social care started to commission, started putting into a pool budget. And then obviously we developed our outcomes even further. So, now, 2010 to date, we've actually come away from the tiered diagram in Liverpool, although we still talk about it, because I don't think you're ever going to get rid of the tiers. But we talk more about pathways now in a child's journey. And we've developed this CAMHS integrated pathway over the last few years, which sort of starts at that Children and Young People Universal Public Mental Health, self-help level, goes on to some early intervention around training, consultation and support, and then it's access to services. And we do have a multi-agency single point of access. It's virtual, our single point of access, I would say. YPAS provides some time into it, so they sit in the single point of access with Alder Hay, one of our voluntary sector agencies. Some of the others have virtual agreements, but Monique and Lindsay will talk more about that, how that works in practice. And then obviously this is sort of the more specialist and targeted part where interventions start. So that's what's happened in the last few years. So we have been through a big restructure, and our restructure and redesign always involved children and young people, always involved parents, carers and a wide range of stakeholders. So, and our stakeholders were very, very wide and did include schools and GPs, because they were going to be big recipients of these services, because there was a lot of training consultation that they could access. So we wanted to get it right. So now we've got we've got our same providers as we did have 3 years ago, really, haven't we? Which is voluntary and statutory, but they are working much more closely. They always did work closely together, which had its challenges, which I'll talk about in a minute, but they work even closer now. We do have more commissioners, because schools have now joined the pool budget, so they give us a pot of money to put with it. And obviously, we've really developed our performance monitoring process as well, and I'll talk about that in a minute. So the performance monitoring, there's quarterly returns that our providers are expected to fill in, which include activity and outcomes. There's developments around the national data set, but I don't know when that's going to come out. I heard next year, maybe. Now? 2014. So we are actually preparing our providers for that national data set. and we're linked into the national benchmarking as well. We do outcomes, which again are on our CAMHS returns, but we're part of Cork. We always have been part of Cork, but Alder Hey used to be our member for Cork, and they were the only ones who used to use it. Now we're as a CAMHS partnership, so all our voluntary sector agencies use Cork validated measures as well. So our report comes back as a CAMHS partnership now. And around quality, again, we have certain questions on our CAMHS returns about service satisfaction, complaints, etc. There's annual contract visits, and I think the word Cork is hidden under there as well, because obviously that measures quality as well. And obviously I think we're getting more of an impact, and we know what's going on now as well across our range of providers. This is our governance structures. This bit's changed, obviously, and is still changing because the world obviously changed on April the 1st. This is our Mental Health and Emotional Wellbeing Partnership Board. That's the strategic group. I've missed a box off here because we do have a joint commissioning, CAMHS joint commissioning group as well here, because there's providers that sit around the table there, we can't possibly be talking about funding decisions. Then we have what we call our operational delivery group. That's our provider forum. All our providers get together, not just commissioned providers either. They are stakeholders basically. FYI is our children and young people's participation framework, and there's representation on both of the boards. And then these are our sort of current working groups around certain developments, single point of access development, participation equalities, IAPT on there as well. And they all feed into each other, and we all work well together. So what does all that mean? You know, we've moved from this tiered model, quite policy driven at one point, to now this CAMHS pathway child and young person journey from public mental health to specialist, with a lot more focus on early intervention and prevention. Well, there has been a reduction in specialist CAMHS, especially from 11-12 to 12-13. And, you know, that's when I say specialist CAMHS as well, our out of area treatment, our tier 4 kids who go into tier 4 inpatients is really, really low in Liverpool. And that's quite good, I think, for a city with such high deprivation. And that's because our tier 3 CAMHS and our voluntary sector are working really well to maintain, to keep children and young people at home. 90% of those accessing the service has shown improvement in mental health, and that's come from the good old Cork report. And 90% show a high satisfaction with services that they receive as well. And there's an increase year on year of universal staff access and training. We do have now a training sort of menu as well, starting from general mental health awareness to some what we call CAMHS masterclasses, which is about what's an appropriate referral, how you refer, and that's done in partnership between Merseyside Youth Association, voluntary sector, and we have CAMHS practitioners across the range of providers doing some of that as well, to some more targeted training. And that's all on our website because we've got a CAMHS website as well. All our providers, as I said, are using Cork measures. The voluntary and community sector are all gone through a rigorous quality assurance process. We have a choice of provider. We've built the local workforce. You wouldn't believe what skills we've got now locally in our CAMHS providers compared to what we had in 2003, 4 and 5. And a lot of that as well was national. There was a lot of national training and workforce development in CAMHS at that time. So we took that opportunity. Our CAMHS practitioners went on it. We have a strong equalities agenda in Liverpool as well. We want to make sure services are equitable for all. Strong participation and a focus on early identification and prevention. And I feel that this year we really were IAPT ready. Last year there was a lot of restructuring that was going on around the pathway. So we weren't really there, were we? So with regards to the challenges, when we started, there was a lot of professional hierarchy. There was, who are you from the voluntary sector? Who, you know, what qualifications have you got? How does the NHS work? What do you mean? There was a lot of it going on. It's taken us, it took us a good while, didn't it? A good couple of years to get that sorted. But once that was sorted, everyone sort of understood what their contributions to CAMHS was, what their contributions to the CAMHS pathway was. And you know what that was? Getting people in the room to talk to each other was more important than anything. Funding. ongoing debate, ongoing battle, especially with the local authority, and restructuring commissioning, restructures at provider level, cuts in services, you know, but we're sort of through that restructuring phase now with CAMHS. So I'd say we're 2 out of those 3 have overcome, and guess which one isn't? The funding. It's an ongoing battle, and I think always will be. So I'm going to pass you over now to Monique, who's going to talk to you about how the pathway works in practice.
So Lindsay and I are just going to talk you through a little bit around the challenges from a provider's perspective, which are similar to the challenges that Lisa was talking about. Okay, so the challenges from a provider's perspective and from a voluntary organisation, Lindsay, as you know, is from Alder Hey, but our challenges were similar, but yet they were very different at times. So a new way of doing things for both organisations, for all the voluntary organisations, in terms of, and again for Alder Hey as well, we needed to have a respect for each other. There was a new way of doing things in terms of working with each other, accepting differences, being in the same room with each other and doing things together. Travelling new journeys together. So there was a new way of, well, the whole climate, the whole environment was beginning to change for us and feel quite new. As Lisa said, there was certainly professional snobbery and hierarchy. So practitioners were often coming back, feeling a little battered and bruised. We've been forming our partnership since about 2005, and it probably took 2 or 3 years before we could make sense and accept that actually we were really complementary of each other, and as long as our vision in relation to the needs of children and young people was the same, then surely that meant something and we could work in a really complementary way. We also needed to be mindful in terms of the challenges of the competition for funding, because again, Liverpool is one of the cities that's been hardest hit. The economy downturn is extremely low. The funding landscape has changed, and we are all fighting for often the same money, and we needed to be mindful of that, but we needed to have conversations about that in order to park it and work well together. A lack of awareness in lots of different things really, a lack of awareness for who we were as organisations, our practice, our qualifications, our accreditations, our philosophy, our ethics, our way of working with participation, our way of working with families, our way of working with each other, and so on and so on and so on. So there was a lack of awareness was quite broad. We didn't have a relationship when we started. We knew of each other in terms of professionals, professional practitioners, professional management, professional senior management, but we actually didn't have a relationship. But what really helped for us, and I advocate for this all the time, and for those that are in the room who have worked with me regionally and nationally, I often advocate for the lead of the commissioner. Because what the commissioner was adamant to do in terms of relationships was to make sure we were in that same room and to have those conversations, those congruent conversations, those difficult conversations in order to generate some type of change for Liverpool, because we knew Liverpool as a city, the needs of Liverpool, the children, young people and families of Liverpool needed us to work together. And somebody needed to start that process for us. And for Liverpool, our commissioners were very much the driving force of that. And I think what really helped, even though it was a challenge, is the fact that it was a challenge that our application for phase 2 was rejected, but actually that firmed us up for the next stage, really. But that was a challenge. And I think, in a sense, there was still some relationships that needed to be formed. How did we address the challenges? I think I've probably just said a little bit there. We forged relationships by the commissioner being the vehicle of that. Joint development and facilitation of training for Liverpool's children's workforce. And Lisa made reference to, we have well, we have a few, but the two main programmes are the Mad Bad Misunderstood and the CAMHS Masterclass, where a collection of facilitators co-facilitate both of those courses to Liverpool's children and young people's workforce. And again, we do that together. That helped with the relationship as well. Active involvement in the development of the comprehensive CAMHS pathway and ensure that we collectively, not just individually, were mapped on the pathway and positioned quite well. How we overcome the challenges, joint training opportunities. Again, a lot of this is underpinned by the relationship. Joint training opportunities, collaborative working, learning from our mistakes and having a trust for each other and supporting each other with errors, mistakes and supporting them with consultation. And I think I'd said this earlier about respect and appreciation for different disciplines and how crucial it is that whoever we are as practitioners, it highly and strongly contributes to the positive outcomes of children and young people's needs. And again, what underpins all of that is the relationship. So where are we now? We have a multi-agency single point of access, which is housed at Alder Hay and led by Alder Hay. So I'd like Lindsay to expand a little bit more on that when she talks. But again, just to say, yeah, that's supported by partnership agreements. And like Lisa had said, YPAS is actually involved in the SPA and we're there once a week and we very much support the choice appointments, the assessment, consultation and so on. We are working collaboratively to fulfil existing service requirements and to secure new service development opportunities. Again, always at the heart of the needs of Liverpool's children, young people and families. And embracing CYP IAPT and the opportunity for further service transformation. And there's so much that we would like to be able to say today in relation to embracing the CYP IAPT principles, in relation to session-by-session monitoring, how we have integrated routine outcome measures into our way of working, how we consulted with young people, and why we feel we are doing so well with routine outcome measures is because we involve young people and always have done from the outset. So they're the ones that have actually helped us make sense of the routine outcome monitoring and the purpose of it. But that's another presentation really, I guess. Okay, and Lindsay, do you want to do the next few slides?
Okay, so our Children Young People's IAPT partnership is made up of YPAS, the Young Persons Advisory Service, Alder Hay Children's NHS Trust, and the Liverpool ADHD Foundation. Well, the ADHD Foundation, which isn't just Liverpool now, it's national and multinational, Tony, it's going. Obviously, that partnership is underpinned by our commissioners in Liverpool CCG and also in Liverpool City Council, and that has been really, really valuable to us, as Monique has said. Actually, when we went to our interview to become a CYP IAPT site, our Liverpool City Council commissioner actually said CYP IAPT is a commissioner's dream because of the routine outcome measures, because it gives us the evidence that we are actually making an impact collectively to the lives of children, young people and families. So in terms of sustainability, we're really, really keen to embed CYP IAPT into our core practice. We all know that it is about service transformation and actually transforming our services to continually meet the needs of children, young people and families. We want this to invest in our staff's training, to be able to recruit and retain good staff, making sure we've got the right people for in the right jobs. And we want to expand our CYP IAPT partnership in future years, obviously to meet the needs of the broader population. So next year we're looking to expand the partnership to incorporate our local substance misuse services, PSS, which works with children and young people who have escaped trauma. So we're not a closed partnership by any means. We are very, very open and welcome. And again, that's all underpinned, as we keep saying, by the relationships that we've got. And we might sound a bit cheesy talking about the relationships, but it's so important. And it has been a struggle, don't get me wrong. I mean, I was previously a commissioner, but when I first joined the NHS, I was actually seconded into YPAS, and some of the abuse, I think isn't too strong a word, that we got was, well, who are you? What qualifications? And I'm sure if there's some counselling agencies around the tables here, you have been scrutinised to that level by statutory agencies. What we needed to get over was, what we needed to get over that really was this comprehensive pathway, because we weren't then competing for funding. We knew where we fit. So that was really helpful, because we could see each other as partners then, and we could see actually what we could do on our own, but actually what we needed our partners in the voluntary sector to do with us, or what we needed to leave them to do because they were the best at it. So we're hoping that, well, this ongoing service transformation will future-proof, that's a bit of a tongue twister, our partnership for ongoing change in commissioning priorities, and that the data that we capture as a part of this will be used to inform future commissioning agenda. Okay, so why did we go for it in Liverpool? Well, as Lisa said, Liverpool is a unique city with very diverse needs. We want to offer our children and young people and their families a greater choice to improve their access to evidence-based therapies. And we want to improve the health outcomes of children and young people. We are willing to learn from each other. And we do have a belief in our model, which I'm going to come up on the next slide. And fundamentally, we've got a belief in our partnership. Okay, so what will it look like in Liverpool? Monique and Lisa have both alluded to the single point of access. The single point of access is currently hosted by Alder Hay, but YPAS are active participants in the SPA, and our other partners are virtual contributors to the SPA. So all referrals come in to the single point of access, to the little funnel. I'm made up with this diagram. I was dead proud of it because I'm a bit IT illiterate. So I was like, "Ooh, this is great." So they every referral then goes through a multidisciplinary or multi-agency triage. If they're appropriate, well, if they're deemed inappropriate at triage, then they are signposted back out to another agency. Should we be patenting this? I see cameras going round. I'm joking. I am joking. Offered a choice appointment. We work to the CAPA model. So, offered a choice appointment so that we can identify with children, young person, their family or carer, actually what is their need, what would be the most appropriate course of intervention for them. Again, if it's an inappropriate referral which is deemed a choice, we would signpost to one of our partner agencies who is most appropriate to meet the specific needs of that child or family. It would be filtered then to one of us as providers. IAPT, CYP IAPT isn't a bolt-on, it's a fundamental part of our service. So actually, like we would offer training or consultation, like we would offer a tier 3 intervention, IAPT is just another intervention model from us. It's not kind of a bolt-on service. It doesn't stand alone. So actually, a young person could come in to be offered a CYP IAPT appointment, but that could be with either of our 3 agencies. Okay. So what's the next steps for us? Recruiting the backfill to posts. I think we're in a better position this year than the previous 2 years because the turnaround is a bit longer for us from when we were kind of successful applicants. We've had a bit of time to plan for the recruitment to backfill the posts. We have released the supervisors. They've already started their training and are loving it, absolutely loving it. And our trainees will start their training in January next year. And so the service transformation begins. We will be implementing the session-by-session ROMs, although we have already started using them to try and get ourselves IAPT ready. Obviously, we'll have the structures and mechanisms in place to address the gift participation priorities. We'll be delivering the evidence-based therapy, so we'll be delivering the CBT and the parenting. We're looking at improving our mechanisms and opportunities for self-referral, and this is one of the areas of shared learning really where ourselves as an NHS trust can really benefit from the expertise of the voluntary sector because they're spot on in terms of self-referral, and we've got a lot to learn from them, and we acknowledge that, and actually it's just one of those areas where we can benefit from each other's knowledge and skills in specific areas and utilise what's best about each other. And improving mechanisms for re-entry into services. We will be looking to contribute to local, regional and national opportunities for shared learning, hence why we're here today, probably in your face all day, but hey-ho. So basically, service transformation will be embedded into the very culture of our partnership, and that'll be through regular multidisciplinary team meetings and the development of a robust communication strategy. So we're not approaching CYP IAPT as three organisations, we are approaching it as a whole partnership. And actually, what the message I communicate to my staff in Alder Hey is the same message that Monique communicates to her staff in YPAS, is the same message that Tony communicates to his staff in ADHD Foundation. Okay. So our future aspirations, we've talked about sustainability, but we did want to mention obviously improved outcomes for children, young people and families. We are looking to further develop and implement routine outcome measures and session-by-session outcome measures as part of the CYP IAPT programme. We're looking to invest in IT to enable user-friendly session-by-session, so the iPads or the tablets, whichever actually makes things easier for children and young people to fill in routine outcome measures and for us to upload them and actually get some information back from them rather than, I mean, I can speak for our NHS system, it's very good at taking information and data from us, but it's not very good at giving us anything tangible back. So we're really looking forward to that opportunity to invest in that and actually move that forward. Again, and to utilise that data to identify the needs of our local population and inform our future service development. And it goes without saying really, but we've got to say it, that children, young people and families are at the heart of development and delivery of our services.
So I guess just to finish off really, what's next for the CAMHS partnership? I'm not sure about that new doctor yet, is anybody else? I just got used to Matt Smith, to be honest with you, but so what next for us anyway? Linz? Oh. So we're very much at a process of commissioning for outcomes, really, outcome-based commissioning. And when we started this whole restructure a couple of years ago, we started with what outcomes we wanted. We didn't start with what do we have. We started with what do we want, what do we want to achieve now. So our main outcome is basically this improved mental health of children and young people, and then there's other outcomes which then form the pathway. That's how we did it. We started with the improved environments and ended up with the reduction in lifelong distress. And then what we did is we put under it this has got now what we've got, but we put under it what we wanted to meet those outcomes, basically. Luckily, we did have a lot of it already, but we did need to build on some of it. And the ones in blue, they're all sort of funded out of the pool budget, because we still have a pool budget in Liverpool. Fingers crossed it'll still be there next year. I've got to go cap in hand to Schools Forum next week to sort of get some money. Then we've got that specialist CAMHS now, that's just out the block contract, which we're also looking at the moment. And then we've obviously got our regional, which is now NHS England. And basically what our plan is really to just, instead of having pool budget, core budget, is just to have a budget to fund the CAMHS comprehensive pathway. So that's what we're sort of trying to look at from a finance side of things. And so it's not obviously perfect, there are gaps. Transition is still a gap in Liverpool. We have done a lot of work on transition over the years, but it still needs a lot of work, and it is very confusing in Liverpool because we have a acute paediatric hospital delivering our specialist CAMHS, which goes up to 16, although our CAMHS go up to 18. Then we have our adult services, which start at 16, which is provided by a mental health trust. So, and they do all the out of hours 16 plus. It is really confusing. But there's a lot of work that CAMHS and AMS are doing around a sequin. We've got a sequin attached. I don't know if everyone knows what a sequin is, but it's an NHS sort of incentive, really, and there's a bit of money attached to it to improve services. So there's a lot of work going on around that, and a lot of work around the tier 3 or 4 pathway as well. We are building on the early years and the maternal mental health work. We are currently looking at a neurodevelopmental pathway rather than separate ASD pathways, ADHD pathways, etc. So there's a bit of work going on around that. We want to put more emphasis on mental health promotion. So we're looking at, how can we really make it everybody's business? I mean, that's been my mantra for the last 10 years. Mental health is everybody's business, and we still need to get that out there into schools, into primary care, etc. There's still an imbalance in access because there's still too many at specialist level. It's reduced, but it's still too high. And the funding represents that as well because of block contracts. And that's why we're doing some work around that too. And integration at commissioning level. I was a joint appointment across health and social care. I'm now a CCG employee. So integration-wise with regards to the bigger agenda is just developing in Liverpool now, again, because of the whole changes in commissioning. Future challenges, again, integrated commission and funding. As we all know, the local authority being decimated. Integrated care, different culture, different personalities across the system. This isn't just with CAMHS, because CAMHS, I think, is a good example of how we're working in an integrated way. I think in the bigger agenda, there's a lot of work that needs to happen. Obviously, the change in NHS, it's changed specifically commissioning-wise over this year, as we all know, and there's a lot of relationships that need to be built. And obviously the economic climate and social determinants. We are trying to, put more into the early intervention side, but you're fighting all the time with the economic climate and social determinants as well. Well, future opportunities, this is what I like to finish on. I don't know whether this is my last slide, but integrated commissioning and care is a priority of Liverpool CCG and Liverpool City Council. Liverpool Children and Young People's Whole Family Agenda. There's always been a big Think Family agenda. Now it's called Whole Families Agenda. Again, that's picking up. It just seems a shame that things sort of picked up, stopped for a bit, and now picking up again in Liverpool because of all the changes. Public health changes in the local authority now. Good opportunity really to maybe cut a bit of cash from them as well. Again, mental health promotion and FYI, more developments going on around the participation agenda, and obviously CYP IAPT will build on what we've already got in Liverpool. Training menu, we're about to go live with. Transition, again with the sequin, there's a lot of information that will come from that. There's some research opportunities that we can do for CAMHS as well in Liverpool, because Liverpool CCG have just been awarded some money for a big research programme called Clark. The neurodevelopmental pathways again is going on, and the data sets. There's obviously the national data set, but we're also working on our local data sets to make sure the activity that we get does relate to the outcomes that are presented then on the map. We want to make sure the activity relates back to the outcomes, so we're doing some work on that. And obviously CYP IAPT is a good opportunity for us as well to build on what we've got. And I think that's it really. You know, this is just to say we all work together as a partnership, provider, decision makers, commissioners, and children, young people and families, specifically under the UNCRC, to make it everybody's business. So any questions, I guess, yeah?
Thank you very much. We have about 10 minutes or so for questions or contributions or things that people would like to put into the discussion. I mean, maybe I can kicking off. But I mean, based on your experience over the last years, if other areas or other groups were looking towards really developing very integrated, really effective integrated care, what would be your kind of top tips for them in terms of taking that forward? What do you think the kind of key things are that you've learned? I know a number of things came out of the presentation, but maybe if you could emphasise what the main things were.
I think there needs to be a commitment around integrated commissioning for a start. I think there really does, because otherwise it becomes one commissioner's responsibility and nobody owns it. You don't own it as a collective, really. And then only one part of the pathway will be commissioned, which is usually the specialist services. And then it's obviously looking at really what outcomes you want to meet as a local area, but obviously looking at sort of different skill mix as well to meet those outcomes and what providers can do it. It needs to be joint and people need to talk to each other. I think communication and relationship building is key to everything at commissioner level and provider level, really.
I think, just echoing that really, I think for me it absolutely is the relationships, and I know I sound like a broken record, but I think what last year's IAPT application taught us particularly was that maybe we took for granted our relationships a little bit, and just prior to our application being submitted, we had a change of personnel locally, and actually we think that's one of the reasons why, well, we're convinced it's one of the reasons why we weren't successful, because the relationships weren't there, and
there was an inconsistency with leadership, I guess, wasn't there, across the
So I'd just got off on mat leave before we were doing the application and stuff, so somebody had come in to take over, and it was just kind of, and I think, so that was key, that it is key for me, that relationships. And actually, if you don't know your partner agencies or who's leading your partner agencies, my top tip would be get out there, get to know them, meet with them and have honest and open discussions, because actually it's not about being in competition for the same little pot of money. It's about knowing what you do and what you do well, and actually where you can complement each other, rather than so that you can meet the whole kind of need, rather than just your little bit of expertise.
And I think it's about ensuring you have children and people involvement as well, because what they say is key. I mean, I always use this example, but when we developed the website, a bunch of providers, including myself, sat round a table and said, oh, let's have a tree with fallen apples off it and all this, and we put it to the young people and they went, nah, let's have an iPhone. And that's how it developed. So, you know, it's you need to listen to them, what they want, and they were key for this restructured as well. They really were. And parents and carers, because obviously, you know, they're looking after their children and people all day, and you need to understand, you know, what, you know, they want a service that they can access easy. They want to be able to know what to do. So they want, you know, to find information quick and easy. Today, you know, we do have a strong participation agenda, don't we? And
just be mindful that transition is about change. So when we go through transition, we often experience stuff that isn't familiar for us. So as difficult as what it feels, sometimes experiencing those difficult experiences together, because you're not just experiencing this as an individual, as whether you are a leader or whether you are a practitioner, you are experiencing those differences, and all these change processes within transition together, and sometimes that can feel hard too. But again, it's the doing it together that can often bring you together as an organisation, and then ultimately as a partnership. Because even though we're advocating for the Liverpool partnership, I wouldn't for 1 minute sit here and say, oh, it's been great, it was tough, it was tough. But I guess we probably really value the journey, and that's why we want to advocate for it, because the journey was so difficult at times.
So it was tough, but it was worth it.
Definitely.
Absolutely.
Yeah.
Okay, great. So do we have other contributions? Karen, do you want to say?
I'm from the third sector organisation in Croydon. We were at phase 2 site, and I'm actually sitting next to one of my colleagues from the statutory CAMHS. So I think we were quite unusual in phase 2 in being a partnership that had statutory CAMHS and 3 third sector partners in our partnership, which I think has led to us being described as complex and interesting and other words like that, because I think there are challenges when you're actually trying to make it work. For me, I don't know what Sue would say, but I would really echo what you were saying about relationships, and I think that's been the thing that's made a difference for us in Croydon. We've actually had a long history of positive working relationships, particularly at that kind of strategic and chief exec level, I think.
Yeah.
We've had a long-standing CAMHS partnership group that have been meeting over a number of years. We've worked together on needs assessments, more recently on the JSNA. So there's a real kind of sense of us working in partnership for actually quite a long time. I think there's still work we've got to do as well, inevitably, and some of that's around kind of probably formalising some of that and making sure it's working all the way through the system, so that at practitioner level, the practitioners in Sue's organisation, practitioners in our organisation are much more familiar. But I think it's been those relationships at the strategic level that's made a real difference for us. Do you agree with it?
I would, and I was interested in your thought about expanding partnerships, because I think it's a complex partnership. There is something about being a large partnership which involves lots of key agencies and actually being commissioned. But I also echo when key players are absent from the table, that creates major issues.
Yeah.
We haven't involved our local authority, for example, so I was thinking that's possibly a next step. So we went out and engaged with the local authority on a fair number of those. So it's just about thinking about embedding these principles, but in a large organisation to make things, I guess, sustainable.
Absolutely. Yeah.
Graham Dyson, we're a third, I'm team manager of Merton CAMHS, and we're a third stage applicant. And I will be phoning you up because we also have partners, and I need to talk to you guys forever. Your single point of access, obviously working with different organisations, and then the clients would go into any of those organisations on the outcome of it. Is that correct?
Yeah, for IAPT, they could, yeah.
Where does the data go? How do you store the data? Because one of the issues that we've got is that trying to get non-NHS organisations on an NHS data system is an absolute nightmare and impossible. And the NHS data is so bad anyway.
Yeah.
Ridiculous.
Well, the third sector organisation's data is better than ours, and basically that's because it's their bread and butter. The third sector have always had to collect data, whether it's been by hand, to basically justify their existence and scrabble around for pots of money all the time. The NHS have had a bit of a luxury, really, and we've been able to rest on our laurels because we tend to kind of rely on our branding. But obviously the world's changing, and we can't. So all we're phase 3 like yourselves. So actually we haven't started yet. But as the lead organisation, Alder Hay has we've nominated our data manager for the trust as the data lead for CYP IAPT, and the third sector agencies will be feeding their data up through the trust.
And what means as well is that, for example, a family could be assessed by the NHS and go to a third sector organisation. How does the medical record, follow them.
Oh,
Or
right.
vice versa, of course.
Okay, well we've got, with our referral form has consent to share information as well on it. But if it's signpost and follow an assessment, then we've got partnership agreements in place and honorary contracts in place, so that actually YPAS staff have honorary contracts with our trust, so the information is governed in that way.
So they can share the information on the trust database.
Yeah.
Can't share database to
You
database.
can't share
You can't-
database to database, no,
Yeah,
just wouldn't.
not database to database.
Unfortunately.
Because I think we have to be also mindful that Alderhay have got their way of reporting their data.
Yeah.
We have our way. So ourselves, YPAS and ADHD Foundation, who are sitting at the back, we're exploring Mega Nexus. So that's where we'll be uploading our information to. In terms of following the journey, the outcomes and the shared thinking, joint assessment, etc., we have those conversations through the information sharing protocols. In terms of where that information sits, depends on what organisation that person is working with. So if they come through the SPA, they won't necessarily be working with Alderhay, they may be referred to YPAS. So we do have our different recording and reporting processes.
So they wouldn't get an Alder help. They wouldn't, if a child comes through us, they would get an Alderhay number in the first instance.
Yeah.
So obviously they're on our system, but then that would be closed and sent to, if the case is referred to YPAS.
Yeah.
I think we just have one more thing. Do you want to?
It's just where, if there's the info goes onto the system where the partnership is doing it. Is that?
Yeah. It's the, yeah.
Okay. Do we have? I think we have time for one final point or question. If somebody would like to.
I'm interested in your transition work, actually, thinking, how do you put all this together with adult mental health services, which may or may not be thinking in a kind of transformational way and having as many partnerships maybe as you might have. So I'm just interested in what the sequence are, what is it you're actually encouraging people to do? Because I'm mindful of what was said this morning by Northern Land, that actually
The age.
transition's a big issue.
I wasn't there this morning, but the transition council that, you mean?
Yeah.
Do you want to talk about that, Lindsay, because you're doing most
Yeah,
of
well, we're really lucky actually, because we've got an excellent working relationship with our adult mental health provider, Merseycare, and that has resulted in, it's not a joint transition, well, it's not a joint protocol around safe transition of care, but they mirror each other, and we have regular transition of care meetings, monthly actually, and then we've been supported by the development of the sequin, which is a joint sequin between both NHS trusts, which has added that bit of impetus to the work really. So basically the sequin is about auditing all of those cases that have transitioned from CAMHS into adult mental health, looking at what's worked, looking at what hasn't worked, looking at actually what were the presenting issues for those children, why was it accepted as a referral into adult mental health when some weren't. So there's a lot of kinds of audit and kinds of data analysis around that.
And do you know actually what they receive when they get there?
Yes, yeah.
My hunch is that actually they can form quite a rich catalogue of interventions in children's services.
Yeah.
And actually it might not have that purpose.
Sure.
Oh, absolutely not, yeah, and we're really aware of that. We've actually got a dedicated team to working on this sequin target, and they are joint appointments between both trusts, so they've got access to both trusts' data systems, and they are thoroughly analysing all that. And the bonus of it is we've been encouraged really to put recommendations forward to the commissioners as a result of the analysis that's going on.
I guess for us, we started off with, years ago, CAMHS to 16, Merseycare 16 plus. Then it was all CAMHS is going to 18, needs to go to 18. We did a lot of work around that, a lot of consultation, and we developed a 16 to 18 team. The demand far outweighed capacity, basically, and then it became a bit confusing, and there were gaps where that came from it. So because it's quite complex, because it's a paediatric hospital and a mental health trust, Measy Care goes 16 plus. CAMHS, even though it's provided by a paediatric hospital, actually does go to 18 because they did get that additional resource years ago. However, as I said, demand far outweighs capacity. So what we're doing with the sequence, we're auditing need and demand, so we can direct our resources in the most appropriate way, basically, as commissioners. But what we're also doing is we are working with NHS England around Tier 3-4 pathways too, because it's all become a bit disjointed, as you know, from the 1st of April around NHS commissioning, and we want to make sure it's still maintained as part of our pathway. So there's a lot of issues around 16 to 18 out of hours admissions to Tier 4 beds nationally. So we're trying to work with our regional Tier 4 providers. I know they're not really regional anymore, but our local Tier 4 providers, Measy Care and Alder Hey, having these transitions of care, is what we call transitions of care meetings, and now do involve Tier 4 CAMHS in them as well, because there's a lot of issue around it, referrals, etc. So there's a bit of work going on around that as well. So I guess this year is a way of sort of identifying need and demand so that we can best place the resources.
I think what we've also recognised as well, though, is that actually there are a number of young people going through transition that don't hit the statutory services, and actually the likes of YPAS are managing to contain a lot of these kids. So we're gathering all that evidence as well, so that we can inform the commissioners of actually what's happening and where the gaps are. I'm
sorry, we need to finish there, unfortunately.
Okay.
But thank you very much to Lindsay and Lisa for adding really interesting